Have you ever gotten a blister? I would bet you gotten at least one. Blisters are pretty common. According to the Mayo Clinic, blisters can form due to pressure, heat, moisture, friction, or burns. For example, have you ever walked around in uncomfortable shoes, and when you got home you found raised skin, typically round shaped on your foot? Well, that's a blister. It was formed due to the friction on your foot when it rubs against the inside of your shoes. This has happened to me before. During Easter, I was wearing heels and we were walking around a lot. At the end of the day, I got a blister on the back of my heel. Thankfully, it wasn't too bad, and according to the Mayo Clinic and Better Health, most blisters are minor injuries that we can treat ourselves and rarely need medical attention. I will go over how to reduce blisters, how to treat normal blisters, and what to do if it's an affected or burned blister. Let's start with how to reduce blisters. Since blisters are common and super easy to get, you can't prevent them completely, but you can reduce them significantly. For starters, wearing gloves and wear shoes that fit well and don't rub. If you can't do that, or if that's simply not enough, you can put band-aids or athletic tape where you tend to get blisters, and you can add extra padding like moleskin. This will help reduce rubbing and pressure. Next, you want to keep your feet dry. To do this, choose socks that are breathable, change your socks often, and or apply a foot powder. This will reduce the moisture and in turn, reduce your blisters. Finally, if you develop a hot spot, treat it as soon as you can. Essentially, if you reduce rubbing, lots of pressure, and moisture, then you can reduce blisters. However, as I said previously, you can't prevent them completely. Therefore, I will tell you how to treat them, starting with normal blisters. When treating these blisters, you do not want to break them open. According to the Mayo Clinic, Better Health, and Health Direct, leaving the unbroken skin over the blister will provide a natural barrier from bacteria, for 1. 2. Reduce the risk of infection, and 3. Help the healing process. If it's not big or it doesn't hurt, cover the blister with band-aid or moleskin. Make sure it's bigger than the blister. If the blister is big, has a lot of fluid, and or causes you pain, then you may break the blister. This is how you break the blister. First, wash your hands and the blister with soap and water. Second, use a sterilizing agent on a sharp needle. Use a sharp needle to prick near the edge of the blister and let the fluids in the blister drain out. Once it's drained, leave the skin how it is. Do not remove it. It provides a natural barrier still. Apply an ointment over or spray like Neosporin over the blister. Cover the blister with a non-stick bandage. If the blister fills up again, repeat the process till it stops. That's not a big deal. Finally, after a couple of days, cut away the dead skin using sterile scissors and apply more antibiotic ointment and bandages. Check the blister for infection every day. This is how you treat a normal blister. Now, moving on how to treat non-normal blisters, like if it's infected or it's a burn blister. According to the Mayo Clinic, Better Health, and Health Direct, you should seek medical attention if you receive a blister caused by a burn or a severe sunburn, if it's infected, if it's becoming increasingly swollen, if it's producing a liquid that's yellow or green, if it's appearing around sensitive parts like mouth, eyes, and genitals, if it appears without any preceding injury, or if you have diabetes, circulatory problems. These blisters are better suited to be checked by a medical expert. You do not want them getting worse. If you get any blisters that I just previously stated, or if you have a normal blister that gets worse, seek medical assistance. Now, let me end by saying it's important to know how to treat and handle a blister, whether it's preventing one by using band-aids or keeping your feet dry, how to treat one if it appears, and know what to do when to seek medical assistance. Just as Francis Bacon once said, knowledge is power, and I hope you use this knowledge to help yourself and others. Thank you for listening.